right? Start. So we will learn about neurological injury and management. It's a very difficult subject because once there is a neurological injury, it cannot be managed. एक बार neurological injury हो जाती है तो कभी manage नहीं होती. It is very difficult to manage the neurological injury. So it is called neurological injury, means nerve injury, brain injury, nervine injury, neuropathic injury, right? All these are hexagonal neuropathy. All this comes under what? Neurological injury, right? Next. So we review the anatomy, physiology, and nervous system of the spinal column, and we will identify the mechanism of head and spine injuries and describe their features. This will be the main objective. First, we'll identify the anatomy, and then we'll describe the features of the injuries of the patient. What are the different injuries? First, overview will be already taught you, so it will be very easy for you to understand. Now, what kind of injuries happens inside the brain and the spine? That we will learn. Clear? Next. We'll describe the assessment of the head and spine injuries. We'll also describe you how to assess which kind of head injury has taken place and what is the spine injuries. The major cause of the long-term disability is caused by the what? Falls. And see, most of the injury, long-term injuries because of the what? Neuropathic injury. Neuropathic means neurological injury, like brain injury, spine injury, and these patients can never recover. So this is the role where you can recover the patients. If you are very sincere, dedicated, you can recover all these patients. Importance of this recovery is very, very important for your whole career. Next. So most of the head injuries can be prevented by the helmets. It is called road traffic accident. So in road traffic accident, you can prevent most of the helmet injuries, right? Next. Now comes a neuron, it's a nerve cell. So you will see in nerve cells, so nerve cell is protected by a fatty cell. This fatty cell, fatty coating is called myelin sheet. It is called what? Myelin sheet.
Myelin sheet.
What is myelin sheet? Myelin sheet is the protection of the nerve. If myelin sheet is degenerated, it is called degenerative myelin. No, myeloneuropathy. I forgot. Hexagonal neuropathy. Hexagonal myelin neuropathy, right? Hexagonal myelin neuropathy. That means all the cases of paralysis, all the cases of this, they become neuropathic cases. Why? Because the electrical conduction in the nerves are degenerated, right?
Right, sir. Gee, sorry, what is NVA?
We'll talk later on. No need to go with all so much details. You're not appearing on what do you call it, exams. Now impulses are transmitted through across synapses. They are called junctions. This is called membrane potential. Action potential. Membrane potential creates what? Action potential. Membrane potential creates what?
Action potential.
Yeah, because of action potential, it is between the synapse, between the gap between the two neural cells. So, the gap between the two neural cells, when transmitted from one neural cell to the other cells, the neurovesicles, it becomes action potential. So, here you can see the anatomy of the cell. Anterior, posterior, connective nerve cell, spinal cord, and this is the spinal cord. So if this is injured, all the nerve, what you see, motor nerve is injured, and sensory nerve is injured. Once motor and sensory nerve is injured, your body is totally paraplegic or quadriplegic. It's very difficult to recover. But with the help of acupuncture, brain stimulation, you can recover this. For your good news, one good news I want to give you in between, I've completed one more book, Paralysis Made Easy. And I'll give only this book to a few people who are really dedicated, sincere, and helpful. Because giving book to all the people by money is your habit. I don't have the habit of selling books and making money. If you don't support me, if you don't learn the basics, there's no use of learning these things. If you don't know myelin sheath, if you don't know what is spinal cord injury, for example, if the spinal cord injury is there, you should immediately visualize. इमीडिएटली मन में आ जाना चाहिए कहाँ इंजुरी हुआ है तो मोटर नर्वस सेंसर इनफ टूट गया Next. So this is what is most important to learn. These are the basics. Now you learn about the spinal cord. We know much about the spinal cord. This is the coronal section of the spinal cord. Where you see the cingulate sulcus, there is the limbic cortex, corpus callosum, and other areas of the brain. It is the internal area of the brain. What we read yesterday is the external area of the brain. There are two areas. What are they? What are the two areas of the brain?
Internal and external.
So this is what?
Internal.
You're right, sir. It is internal. It is called coronal section of the brain. Right? The white color what you see in between is the corpus callosum. Right? Next. So the spinal nerves makes their synthesis. So the nerve which is damaged is only will define which sense you will lose. That is called each muscle is supplied by each nerve, right? What did I teach yesterday? I taught you each nerve supply each muscle, right? So if each muscle is injured, you have to regenerate and recover that muscle to recover the muscles. If the nerves are not recovered, the muscles will never be recovered. Am I right?
Yes, sir.
Next. Your meninges are protective of triple layer cover. So meninges are what? They are protected of triple layer. What are they? Dura, aracoid, and pia.
Yeah.
The outer metal is called what? Brain is protected by three metals. What are they? Dura
Durameter, arachnoid,
and
pia matter.
pia. Right?
Yes, sir.
And cerebrospinal fluid circulates within this. Right? But there is
Yes,
all
sir.
concept. G lymphatic system has generated the simple another system. Right?
Yes, sir.
No. Next. Do you can see this is the fascia and this is the muscle. By releasing the fascia, people say fascia can be released by this, that, this. It is not possible. If you read a close anatomy of Ganang and all, it is not possible to release the fascia like this. A proper impulse has to go, like acetylcholine, dopamine and all, to release the fascia. So you can see different layers of the brain anatomy. Am I right?
Yes, sir.
First layer, second layer, third layer. Next. So now you understood the anatomy of the brain, cerebellum, and brainstem.
Brainstem.
So anything which is damaged near the brainstem, post-stroke, it leads to paralysis. Today, Parkinson. Today I will teach you how I have recovered Parkinson's patient in 20 sessions by 90%. He came almost with a wheelchair. Now he is walking with a stable hand and no tremor in his leg. Yes. So here we have to define cerebellum. Cerebellum is divided into 4 parts: frontal, parietal, cerebral, temporal. Cerebellum is responsible for fine movement. So the gait movements, circumjective gait and all what you are getting, the legs are not going good, it's not working well. Why it is? Because of the cerebellum movement. Brain is divided into 3 parts. What are they? Brain, cerebellum, brainstem. Brainstem is responsible for what? Lungs, heart movement, and everything. So if there is a nerve compression, then there is a chance of what? Myelopathy, and myelopathy may also lead to heart attack. Am I right?
Yes, sir.
Are you able to understand what I am speaking, all of you?
Yes, sir.
Yes, sir.
Abdul-
Yes, sir.
Yes, sir.
Yes, sir.
Yes,
Yes,
go
sir.
ahead. Go ahead. So you will see the cranial nerves. They originate at the base of the brain. Where they originate? At the base of the brain. You can see behind. The base means what? This is the frontal. This is the base. So at the base of the nerve, you will see how many nerves? 12 cranial nerves or
12.
16? Yes, there are 12 cranial nerves. How many are there?
12.
12.
12.
12 pair.
And which is the most important one? All are important.
Vegas.
Dear, all cranial nerves are,
Important.
yes. Because they provide sensory and motor supply to the head and face.
Yes.
Right?
Yes, sir.
Next. This is, you can see different types of cranial nerves. Optic, oculomotor, tricular, trigeminal, abductor, facial, vestibular, glycofacial, vagus nerve, and accessory nerves. Right?
Yes, sir.
So you could see different nerves. Now if you stimulate the brain, you can also stimulate this nerves through different pathways, and you can revive the eyesight and ears also. I've recorded many deaf people in my life. One
Okay,
of such
sir.
incidents was seen by an Australian doctor who came all the way from Australia to learn from me from Malaysia. She will also take the class. You can take that experience from her. Right? And that video is online. And it is with her. So this is the anatomy of the spinal cord.
God.
Am I clear?
Yes, sir.
So the uppermost is the spinal cord. If it is injured, everything is what? Damaged. And the more you injure, more you leave it untreated. The patient with exercise, it destroys the entire spinal nerve system and the patient never recovers. Exercise is given to survive the atrophy of the nerves, not to recover the patient. Am I clear?
Yes, sir.
Yes, sir.
Next. There are 2 types of nerves. What are they? Motor and
Sensory nerve.
motor nerves helps you to move your body. Sensory nerves gives the sensation. So sensation is given to the brain and brain responds as per that sensation. Right? So sensation goes from brain to the body to the brain and motor response from brain to the
Muscles.
Muscle. Am I right?
Yes, sir.
Yes, sir.
Clear. Next. Here you can see the anatomy of the somatosensory voluntary system, how the brain and muscle works. So if this connection is not made, whatever exercise you do, it can never recover the paralysis or any neuropathic symptom or any neurological diseases. You cannot rebuild these connections simultaneously. And that is why my innovation of how to make it easy so that 10 years work can be done in 10, 20 days, right?
Yes, sir.
So autonomic nervous system and involuntary nervous system. There are two types. What? Autonomic nervous system and involuntary. Involuntary is the heart and nerve. Autonomic is the eye, muscle, mouth, hands, legs are autonomic nervous system. Am I clear?
Yes, sir.
Next. Severity depends on the amount of primary and secondary brain injury. Now comes the main injury. What type of injury you are recovering? It is a severe injury or a small injury. The most of the patient which I get is very severe brain injury. So the primary injury is the initial trauma and main cause of the secondary injury is hypoxia.
Hypoxia.
Hypoxia means lack of oxygen. So there are two types. What is trauma injury? And second is
Hypoxia.
Hypoxia.
lack of oxygen in the brain.
Brain.
Clear?
Yes, sir.
Brain.
Clear, sir.
Next. So you will see traumatic brain injuries because these injuries happen because of the accidents. What they happen because of the different type of accidents. You will see a lot of accidents happening every day. It is why I say you have a very bright future in life if you can really concentrate and become a group, help each other, so that the cost becomes less and we can invite more and more people to help you, teach you. But then you have to work. Without your work, nothing is possible. Nothing comes easily. You have to struggle and take it out. Right?
Yes, sir.
Yes, sir.
So you can see the traumatic brain injury. Now in traumatic brain injury, there are two types of surgeries. What are they? Cystinostomy and keratotomy. Generally, there are two types of surgeries. What are they? Keratotomy and
Cysternostomy.
keratotomy is done by cutting the brain, and cystinostomy is by going inside, going as per the atmospheric pressure and removing the supracellular cistern, so that the edema inside the brain is reduced and the recovery is done. Temporary loss of a part of all brain abilities to the functions without apparent physical damage to the brain. So, traumatic brain injury, it affects the brain in such a way that it loses all parts of functioning in the brain and gradually you recover. And sometimes you gradually automatically recover. By physiotherapy also you recover. But physiotherapy is a very slow process. But if you include brain stimulation, nerve stimulation, the speed becomes very
Fast. Instant.
yes. Thank you. Next. Now we are studying about types of brain injury. So it is called cerebral contusion, precise brain injury. You can see, number one, far more serious than a concussion. Involves physical injury to the brain and may be long-lasting or permanent. It happens during the accident when you hit the skull hard. So you have a bleed inside the brain and it is very difficult to recover. Generally, midline shift is there and the patient is always in the stage of coma. Sometimes he recovers from the coma, but difficult to live and die. Next. Cerebral hematoma bleed. You can see the bleeding inside the brain. It is called subdural, intracerebral, and epidural. What it is called? Subdural, intrasubdural, cerebral, and epidural.
Epidural.
Clear?
Yes.
What are the three types of bleed? Subdural, intrasubdural, and
Cerebral, epidural.
Epidural.
next. So what are the traumatic general signs and symptoms? Headache, dizziness, nausea, vomiting, and amnesia. Right?
Yes, sir.
Yes, sir.
Remember the symptoms. Next. So you record decrease the level of responsiveness, confusion, competitiveness, and loss of responsiveness. It corresponds to the extent of loss of brain function and progressively deteriorate usually indicates the serious brain injury. So it deteriorates the brain injury and the patient becomes more and more sick and later on he dies. So assessing traumatic brain injuries level of responsiveness is called APO. APO scale. What do you call? APO scale. What are they? A for alert. P for
Verbal.
Verbal.
P for
Pain.
pain. U for unresponsive.
Responsive.
OBO for offline and monitor frequency. Right?
Okay.
Okay.
What is called FU scale. Next.
Of the scale.
So any type of this progressive brain injury will increase the intracranial pressure, hypoxia, further secondary injury, motor swelling, and increased ICP, intracranial pressure. So if we increase intracranial pressure, there will be midline shift and the life of the patient is in danger. Within 72 hours, if the EMD is not done, the patient may die. Clear?
Yes, sir.
That is why neurosurgeon said we can save life, we cannot protect the life. Now, the first thing you will see is the reactivity to the light. It is called pupil dilation. What it is called? Pupil?
Dilation.
Yeah. When you put light on the pupil, it will dilate, means it will go small. If pupil dilation does not go small, it becomes the brain is dead. Slowing of pulse and rising of BP. Right?
Yes, sir.
So what are the things you will see? Incontinence, unilateral weakness, seizures, and change in respiration. Right? So if you have an urgent intervention, any cervical injury, you have to immobilize it with hard collar. It is called what? Hard collar. What it is called?
Heart collard.
So that you don't move your neck. Right?
Okay.
If you move your neck, what will happen?
More
They will-
nerve will be damaged.
No, sir. It may become myelopathy or you may become quadriplegic.
Okay, sir.
What you will become?
Quadriplegic.
Or myelopathy.
Myelopathy.
or quadriplegia.
Or paraplegia. And incontinence of bowel and bladder. Am I right?
Yes, sir.
Always open airway, administer oxygen, do not hyperintervenate and treat bleeding with shock. So this is the way by which we recover the patient, right?
Yes.
Next. Prevent aspiration of vomit and secretion. So first thing is that we have to what? Transport immediately to the patient to the hospital and we have to prevent the vomiting. Vomiting is very dangerous at this moment of the brain injury. The first symptom which we ask to the patient, whether the patient has vomited after the brain injury or not. So if it is a vomiting, then it is a red flag. Red flag means what? Red line. It's a serious injury inside the brain.
Brain.
So how much vertebrae we have? 33 vertebrae. What are they? 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, 4 coccyx. Right? How many? 7 in cervical,
12 in thorax.
12 thoracic, 5
5
lumbar,
in lumbar.
5 and 4
Last
pop.
one couple.
Clear?
Yes. Yes, sir.
Next.
Yes, sir.
Next. This is a typical vertebra, you can see. The transverse process, the spinal cord, which is after the transverse process, and the body. And that is a nerve root. So now you can understand why it is very difficult to treat nerve root if you don't do carefully, if you do chiropractic and all. By chance the disc is compressing the nerve badly or the cord is injured, what will happen?
Paralyzed.
Huh? Paralyzed and death.
Loss of senses.
Sensory deficit is one of the things, but most important is paraplegia.
Yes.
And other deficit is what? If it comes to cervical, it becomes what?
Death.
Death. Clear?
Clear.
Next. So now you can see kyphosis and all are produced by compression or bending of the stomach. So if you have pain and you bend your body or you take a compensatory movement, all this leads to the damage of the spine and this leads to the damage of the further disc. Pain at the injury site, localized and acute tenderness. Right? So
Yes, sir.
always you will say localized, it will be local tendernized, but it is there to make your spine scoliosis, means it will bend the spine and it will damage the entire spine. It will make the entire spine unstable and the patient may lead to what? Scoliotic spine, and it may sometimes lead to what? Tell me what? Severe pain and also multiple dysfunction of the body. Right?
Yes.
Next. So deformity is usually not obvious. It is self-impending and guarding. It is generally done by your own self. You bow again and again, and it happens like this. Right? Next. Here you can see cervical compression. The major injury is done in which cervical area? C4, C5, and C6 because they are used for bending the neck. So cervical slip disc happens in which area? C4.
C4, C5, C6.
Am I clear?
Yes, sir.
Yes. Next. Next. Now significance depends on upon whether the spinal cord is, how much it is injury. There are two types of injury. There are many types of injury: myelopathy, myelopenia, partial and temporary and transaction. There is nothing called temporary. Yeah, temporary means wedge fracture, but it is called which fracture. So it is automatically recovered. Otherwise, compression fracture is the main injury, right? So compression injury happens more in the mid and cervical area, right? So always take care of neck flash injury, cervical and dorsal, thoracic region. Otherwise, if you have injury there, you lose your life forever. Clear?
Yes, sir.
The spinal cord injury depends on how much nerve is injured. Now, can this nerve be recovered? Yes, this nerve can be recovered. Myelin sheet of the nerves can be recovered, not by a medicine means. It can be recovered by the body itself, by stimulation. By certain stimulation, you develop certain things, and by which spinal cord injury can be 100% recovered, but you have to take hard effort and good stuff. If you put stuff like me, it becomes difficult. You have to work hard day and night, and at the end of the day, you will have a heart attack. Pressure is always there. Wherever you work, pressure is there. But in this pressure only, you can learn. Paraplegia means both legs, quadriplegia 4, and hemiplegia 1 side. Clear?
Clear.
Yes, sir.
Next. Next. Finished? So you see abdominal sensation, loss of sensation, muscle weakness or paralysis. Right? Next. You'll see signs of neurogenic shock, difficulty in breathing, incontinence, and paraplegia. Yes. Continue. Please continue. So emergency care should be taken away so that you can save the life of the patient and you can stop him from bleeding and breathing. Bleeding takes from the cord, right? Bleeding takes from the cord, nerve, muscles, right? The more it is bleeded, the more dangerous it becomes, right? So neck collar has to be put up so that his neck is stable and he does not put movement of the neck and care for both other injuries, right?
Yes, sir.
Next, transfer the spinal board with proper technique to the minimize movement. Immobilize on long spine board with CID applied supply. Apply cervical collars. Right?
Yeah.
Next. Next. Thank you. Now you may ask me a question. Close the slide. Ask me a question. Please ask me your questions, please.
Sir,
Yes, sir. Please tell me.
how to stimulate cranial nerve by dry needle?
See, cranial nerve has its own pathway. Different cranial nerve can be stimulated by different ways. For example, vagus nerve, it has to be stimulated and has to be removed by pain. You use what? What do you call? What protocol? I forgot the name of the protocol. Used by Army, na? Mickey, what is the name of the protocol?
NIBS.
No. In years. We put 5 needles, na?
Mm.
For cranial nerves.
For cranial nerve, no, Mickey. 5 needles in the ear is called what? Battlefield acupuncture.
Yes, betals. Oh, yeah, I see. I forgot.
Yeah. So battlefield acupuncture is a stimulation of the vagus nerve. Similarly, similar areas, you have to combine with different pathways and nerves. And then you can stimulate it. And then neuropathic symptoms can be recovered.
Yes. Different
that's-
cranial nerve, different pathways, sir.
Yes. Different cranial nerve work for different areas and they have different pathways. Right?
pathways.
Yes.
Because going to Rome is different, going to India is different, going to Indonesia is?
Also different.
Yes, right.
Okay, thank you, sir.
For what? You are telling me to go out of the classroom?
No,
No.
for answering his question.
Oh, I thought you are telling me to go out of the classroom.
No, for answering the question.
I am there to answer all your questions. After all, I am your teacher and your friend also.
Yeah.
If I don't answer your doubts and clear, who will clear your doubts? Who will make you a physician tomorrow? These are the basic things you must understand. Why osteopathy has not to be done, why this thing has not to be done, why nerve compression, what is the anatomy of the cord, if something goes wrong with the cord, what will happen, what is bone TV, port spine. So if anything goes wrong, what will happen? Paralysis of the patient.
Or even death.
Hmm.
Sir, good evening, sir.
Please tell me, sir.
Johnson from Shiliguri, sir. Sir,
कौन
these are
कौन बोल रहे
the.
हैं?
Sir, मैं जॉनसन बोल रहा हूँ सर शिलीगुड़ी से.
अरे केड़ो कम ভালো?
हाँ बोलो सर.
একদম ভালো
Sir,
না একটু একটু ভালো?
খুব ভালো স্যার. থ্যাংক ইউ স্যার.
খুব
আপনি কেমন
রসগোল্লা
আছেন স্যার?
দিচ্ছি না মা ভালো?
স্যার আপনি কেমন আছেন স্যার?
আমি চলতে আছি আমার তো এনে দে just going on. I have to pull on till I die.
ठीक है. सर ये तो जो
हाँ।
आप आज का जो क्लास में ये तो बेसिक स्पाइनल नर्व्स क्रेनियल नर्व्स सब बहुत अच्छे से आप समझाए हैं सर. सर ये जो बट मूवमेंट कंट्रोल के लिए जो सेरिब्रम सेरिबेलम का जो कनेक्शन सर वो तो
वो
कहीं
बेटा
भी नहीं है. आप ही हम लोग को
it is
बताना
called
पड़ेगा.
non-invasive brain stimulation. You
हाँ
have
सर.
to stimulate different pathways from the brain,
हाँ
inserting
सर.
new needle in the different cerebellum area. Today
हाँ सर.
this, tomorrow that, tomorrow this, seeing the results.
हाँ सर.
And that is a practical pathway which you have to learn from months.
Yes, sir.
Otherwise, circumdictory gait, all this can never be recovered. Patient can never, you can make him spastic, you can never
Yes, sir.
recover a patient. Because
Yes,
all
sir.
these moments comes from where?
Sir, sir, जैसे sir, how I mean, when we learn, when are you going to tell us, sir, about those connections, cerebral or cerebral
Because
connection with the
until now your basics are not clear. How will I teach you inside the brain?
sir?
That is why I say you need more and more teachers so that I can invite whom? Neurosurgeons who can explain you more better than me. My
Yes,
friends
sir.
are there, but you have to pay what? 10,000 rupees per lecture. So
Yes, sir.
if everyone pays 500 rupees, 10,000 comes, you pay him. But what knowledge you earn is very important from him. In
That is
10,000,
true.
you are going to lose nothing. So I
Yeah,
say,
definitely.
advertise, bring more and more people. I could not invite a single neurosurgeon because in my
Okay.
seminar, only 14, 15 people come.
Yes, sir. Yes, sir.
You
Sir,
know,
yes, sir.
what is the major role? Major role is not surgery. Major role is recovery.
Yes, sir. That's right. Sir.
Our biggest mistake of our life is we blame neurosurgeon for the damage. Neurosurgeon is not responsible for the damage of the patient. It is the physiotherapist, it is the occupational therapist that we did not take our effort to recover the patient. We are still working with the old knowledge. We have not
Yes,
improved our knowledge.
yes, sir.
You
You're right,
imagine
sir.
every day I see videos of chiropractic in low back pain. Imagine there is a disc extrusion, and if you damage the spinal cord, what will happen?
Yes, sir. You're right, sir.
We have seen all these cases. People become paralyzed forever. Right?
Yes, sir.
More questions? Those who are interested to join my course 6, they can join online courses. This certificate will be issued within 2 days.
Yes, sir.
Those who have attended the class, those who have not attended the class, I cannot help. It
Yes,
is
sir.
your knowledge which will improve your skill. My work was to give you the
Sure.
videos, whatever
Yes,
I
sir.
said, I am teaching you one by one.
Okay.
Right?
Thank you, sir. Thank you, sir.
I have completed the acupuncture. Now I am teaching you anatomy, and comprehensive anatomy means division of all the subjects whichever are responsible for neuroanatomy, neuropathway, cranial nerve, how cranial nerve is important, and different pathways which you will understand. Why, if you don't learn NIBS, why you don't understand brain stimulation, you cannot recover most of the diseases, because the connection between the brain and the nerve is not established, and you can never recover the brain. You keep doing exercises, you may recover some part, but you may never see what? You may only see spasticity, not recovery of the
Complete recovery is not possible. Yes, sir.
complete forget. Partial recovery is also very difficult in the patients.
Yes. That's right.
Right. Next.
Sir, I want to confirm about the holographic. Where the first thoracic start.
See, it all depends from what approach you want to take. You want to direct approach or indirect approach. Direct approach will never recover the patient of thoracic injury. If it is spasm, pain, it will recover. But direct approach or thoracic injury will never recover any type of injury in the thoracic level. It has to be approached in a very slow and what? Different way, careful way. Why? Because brain has to respond to the signal and try to send what? Whatever is required to recover that area. Now, if the brain gets wrong signal, what will happen? The brain will give wrong signals to the area and brain will damage the further area. Am I clear?
Yes, sir.
Both brain and spine will be damaged forever. That is why I say, don't use massager pain, don't use this, don't use that, don't do that, because you do not know what is injury. If one injury happens in your life, your entire career will be finished. So don't make experiments with your career. What do you not make? Experiments with your career. Always use the right and safe system. Like the pen which I use is safe. Why? Because I know if you use in a wrong way, it will not damage the brain. It will hyperpolarize and it will send signal to other area and brain will not damage.
Use proper tools. Yeah.
Use always proper tools while treating the medicine. For example, will you give crocin for malaria? Paracetamol for malaria?
No, sir.
Or you will get hydrochloroquine?
Hydrochloroquine.
So why don't you give paracetamol to recover malaria? Both are tablets. Both can be given.
Yes, sir.
Now you can understand how much weak is our knowledge after 11 and 14 years of studies, because we never studied our subjects from basics. Now you understood the basics. Now no one can what? Move your knowledge, because you have a question that if this is damaged, what will happen? Remember, you all are physicians. You are not a second-grade physician. You should be a first-grade physician. You see, every day I teach orthopedic surgeons from 10 to 1. They become my so good friends that I teach them, you do this, you do that, you do this. And now we have learned orthopedic neuroregenerative therapy with the help of stem cells. Ortho neuropathic regenerative therapy means you can recover the neurons, nerves, and you can also try to recover the brachial plexus injury. And now you have started recovering retinitis pigmentosa, staphylomas, all these diseases from the eyes of the people. Clear?
Yes, sir.
Yes, sir.
Next.
Sir, about the patient who has already 5 years Parkinson. I saw, I saw there is kind of infused needle. What did you give her?
Can you please? Can I please put the video? Can you please put the video today? I have uploaded the video. Can we please see the video of today?
Walid, can you help?
Sir, the stroke patient?
No, the
Parkinson,
Parkinson.
5 years old Parkinson.
This stroke patient has 70% damage in the brain and he is recovered by 50% today. आपका क्या कंडीशन था आगे जब आए थे? So many patients of Parkinson, and this is one of the patients of Parkinson. This patient was suffering from very bad condition of Parkinson, and it was very difficult to walk, move, and he came with a very difficult steps. आपका क्या कंडीशन था आगे जब आए थे?
जब आगे आया था, जब वो डंडा पकड़ के बुढ़ा जैसे आ गया, अभी थोड़ा चल रहा।
अभी आप चल के दिखाइए कैसे चल रहे, फटाफट चलिए. He came with like a wheelchair patient. Now you can see how he's walking. डंडा कहाँ है?
डंडा का रूप में
कितना दिन में रिकवर हुआ?
अभी 20 days हो गए।
So you can see in just 20 sessions, he has recovered more than 70%. You are unable to move. Now you can see hands tremor. हाथ को सीधा कीजिए, ऐसे कीजिए, आँख बंद कीजिए, आँख बंद कीजिए. I asked him to close his eyes to see the tremors of his hands. Now you can see there are no tremors. There is no tremor in the hands. No tremors. Good. हाँ, नाक को ऐसे और ऐसे टच कीजिए, बिना उंगली को टच कीजिए, इधर टच कीजिए. Good. So you can say there is a very good coordination. अब आगे आपका हाथ कांपता था ऐसे?
पहले काम था।
अब कितना कांपता है?
अभी जब इफेक्ट हुआ था तो होता था, तब थोड़ा बहुत काम था।
You can see he was there was a very high tremor. Now there is no tremor. Have been reduced to a great extent in 20 days. Here it proves that in many cases of Parkinson's, this treatment is helpful. आपको कितने साल से पार्किंसन है?
4-5 साल।
This is a 5-year-old Parkinson's patient. Generally, Parkinson has no treatment. Somehow NIBS is supporting Parkinson, and this is a very good recovery. We have taken our subscapular, what you call, neuromuscular acupuncture, which helps in Parkinson's in an effective way. Thank you so much. Ask me a question.
You said that it has been 20 sessions. What I'm asking is, did you also give him kind of stem cell or nutritional therapy?
Yeah, we gave him both orthopedic stem cell and neurogenic stem cell, and also brain stimulation, nerve stimulation, and also Syndopa was taken. We did not withdraw the Syndopa, but after taking Syndopa also he was having a lot of tremor, was not able to walk. Now you can see how beautifully he is able to walk.
Oh, okay. Thank you, sir. Very beautiful. No more tremor at all.
So this is what I want to teach you all. But if you all don't support me, forget any support from my side.
Yes, sir.
If you cannot encourage others, why should I encourage you? A new knowledge has to come in the society to recover these patients. They come from long way to me. There is no one to follow up. How can patients recover in 5 days? Can you recover Parkinson in 5 days? So many, what is the changes you can bring? You are asking me to teach so many subjects in a day. Very difficult, can't recover. Next.
Hi, G.
Yes.
Can I ask you a question of last night's subject on stroke?
Please, sir, you are allowed to ask all questions. You are my best friend.
Yeah,
Even if you ask my life, I can give you.
No, I don't need that. Because last night you discussed about the ischemic and hemorrhagic stroke. How about the so-called ischemia? I mean, Aneurysm.
See, aneurysm is a bulging of the artery. So it has to be clipped. If the bulging is blasted, the bleeding comes, it becomes a hemorrhagic stroke, right? So it has to be recovered by the clipping.
Clipping.
Aneurysm is not a stroke. Stroke is only classified into two parts. What are they?
Ischemic and hemorrhagic.
Yes. Aneurysm is classified in lateral stages. What? Either ischemic or hemorrhagic. Because it creates pressure inside the brain, it may become ischemic. It may reduce the blood supply. It may become ischemic. It may it may bleed. It may become what?
Hemorrhagic.
Yes.
Thank you.
More questions?
Hello, sir.
Yes, madam.
My question here is concerning lacuna beans. As we talk about Parkinson's disease. Now, can that be?
Lacuna can never recover Parkinson's. Rather, it is a degenerative disease. It will more degenerate the brain. It will more degenerate the vagus nerve and the gut, lungs, and it will increase Parkinson. It will never decrease Parkinson. Right? Macuna beans or Macuna beans? What are you saying, madam? Hello?
I was to
Mukuna
lacuna beans.
जो पलासा का बीज की बात कर रही है ना, दत्तुरा की बात कर रही है रावत जी।
जी सर।
ये पलासे की बीज की बात कर रही है, दत्तुरा की बात कर रही है। दत्तुरा ये हम लोग यूज करते हैं ना। हाँ
पता नहीं सर, मुझे भी नहीं समझ में आया।
Walid, can you explain me what she is saying?
It is also unclear to me.
My question that I was asking, sir, I was saying concerning the support after even the NIDS that can lacuna beans be given.
Macuna beans contains highest number of dopamine. It is a very good drug, but then you must know how to do NIBS in Parkinson. I have written a book and I have already completed. I told you I have written around 45 books. More than 50 books I have written in this life. And I have completely written. I made many atlases and you will also get in future. Only sincere students should get it. Otherwise, if you are insincere today, what will be the sincerity of tomorrow? So only sincere people will get. And those who help me and those who are really sincere, they should get this knowledge. Otherwise, there's no use of teaching others.
Thank
You
sir.
keep silent, I also keep silent. Your certificate will be issued, but our course will be completed on 1st of June, right?
Yes, sir.
My health is not okay, so I want to issue the certificate. Please don't mind, huh?
Okay, sir. Thank you.
Those who are interested only in the certificate, it's very good. Those who are interested in knowledge, they will get what? Reward in long run.
We need knowledge, sir.
Tell me, madam.
Sir, we need knowledge, sir.
It's all up to you what you want. I never said you want knowledge, because without knowledge, there is no money in this world.
Right, sir.
Money can be finished tomorrow. Knowledge will always bring you money.
Yes, right.
Next.
Dr. Sastri like to ask my question.
Oh, this
Hi.
Kia, my favorite student. Thank you so much, brother. I thought you are still angry with me.
Thank you to you too.
You see, I recognize your voice with my closed eyes.
Sorry?
My eyes are closed, but I can recognize your voice.
That's good.
Tell me, brother, how can I help you?
My question is, how come strokes lead to more bleeds after 5 years
See, stroke means
or
what?
within 5 years?
No. Stroke means an arterial rupture inside the means arterial breakup inside the brain. So bleeding continues to be there inside the brain, right? If now bleeding is not stopped, or if the surgery is not there, there will be more and more swelling called edema. This edema will lead to midline shift. This midline shift may reduce the Glasgow coma scale. Glasgow coma scale means G for what? E4, V5, M6. So I, voice, M4. So if this is reduced, you can understand the life of the patient is in danger. Now the first thing is you have to stop the brain from swelling so that the brain craniotomy is done. It was started in 1905 by Kocher, but this is an old technique and it makes the patient paralyzed for years after years. But if you follow sternostomy, you recover the patient in 5 days to 10 days. It is very difficult. People have not accepted, but people has to accept it tomorrow, sternostomy, because sternostomy will help the people to recover the patient.
Thank you.
More questions?
Good evening, sir.
Please tell me, sir.
Sir, in a case of Parkinson, shall we approach for the cranial nuclei, or shall we approach from the muscular?
How will you approach cranial line nuclei? Are you going to operate the brain?
Regarding Parkinson's, while
how can you do that?
With
I'm
the
sorry to ask you. I want to ask you a counter question. Please don't mind.
Ji.
Am I allowed to ask you a question?
Ji.
How will you do that?
With the NIBS approach.
What is the procedure of NIBS to recover the brain? What are the steps of Parkinson's? And about which Parkinson are you speaking about? Idiopathic Parkinson, Parkinson's plus, induced Parkinson. Which Parkinson are you speaking of?
The Parkinson.
Which stage you are speaking of? Bleeding of Parkinson.
The one Parkinson patient we have just played the video where the tremors had been controlled very shortly. So what it is a muscular weakness?
My approach is very, very different. I have taken out the new approach called neuromuscular feedback. This is my own typical feedback of the median spasm, where I reach different types of body acupuncture points with brain stimulation simultaneously I do, and I get immediate results. I never stop at one place. I always try to recover more, because I lose one case, I don't recover one patient, it is a pain to me. Again, I do research, I understand more and more pathway, and I try to recover more and more patient because this was post-stroke Parkinson and I wanted to recover this. I was failure in one Gujarat patient, but this time I do not want it to fail. So I recovered it in just 20 days. And we have reduced this syndopa dose. That is why, Anand, I said, we have to open a joint clinic and we have to work together. Before I die, you have to learn all these things so that you can pass the knowledge. I always request you people that I'll come to Gujarat, I'll help you. Make my fees 10,000 rupees for 5 days. We do joint work so that I can teach you everything nicely, practically. But then you people are so silent. I was thinking of giving you the best books, but when I spoke to Joshi today, I was really disappointed. I rather felt that it is better not to give the books, better to die with this knowledge. I'm openly saying, what is the use of giving the knowledge to the future generation and people like us who are not interested to learn, not interested to support the people? When I am alive, when I'm teaching you the shortcut methods, why you all are not interested to learn? Why are you all are not becoming one group? Can you do the work of physiotherapy? Can the physiotherapy recover the patient of Parkinson? Why don't you combine these two knowledge? You all are very good homeopathy doctors. Why don't you combine all these things together? You have very good oil knowledge. Why don't you combine this? Why don't you make a ozone and all these things together? You see, I'm making an ozone clinic again. I was against ozone. Now I'm making an ozone clinic. I've combined ozone with so many things. Only one sentence is still repeating in my mind, that one ozone should be given to the patient, it recovers. By whom? By the anesthetist and by you. Only with your word, I have changed my mindset. I studied and I believe that it will help. Now you see, I'm making an ozone clinic here, but with my own research. And now you can see Parkinson, not only Parkinson, you can recover staphyloma, retinitis pigmentosa, staphyloma, although it will take time, but the patient will not be blind forever. One side is whole life blindness, one side is few months blindness. Let him think. One side is whole life spinal wheelchair, one side is small wheelchair. One of your students came to me. He does not even know how to behave. I was very angry that he does not know how to speak to a paralysis means what? Non-mobility of hands and legs. This person is having what? Basal ganglia, right? Basal ganglia damage. So basal ganglia means what? A damage of Parkinson. And then I was trying to make him understand that this has to be done. And this person says that within 2 months you have to recover the basal ganglia. You have damaged the patient with a lot of paralysis. You do not know how to manage the patient. I'm not saying you, Anand, right? You means general people, right? And then you see what has happened to the patient. Patient will have more and more symptoms of Parkinson. Tomorrow you will see, you will have basal ganglia, CBGD, capsulobangular, what you call capsulobangular degeneration. Because there is second stroke. You don't allow neuroplasticity to occur inside the brain. You don't allow things to happen. You don't follow up with things. How patient will recover? You are working with what? You are thinking like 1905, what neurosurgery is doing, Kocher is doing, what Geo Sun Phai is doing, without learning neuroanatomy, without learning the motor supply, nerve supply. You are trying to recover the patient. Is it possible to recover without generating electricity in the nerve? You see, we have done more than 300 stem cells. Today, we have ortho neuro stem cells. And I am teaching orthopedic surgeon and they are coming to learn from me at night 10 to 1.
Great, sir.
You are saying orthopedic doctors are against it. You have all the certificates are signed by orthopedic, microvascular surgeon, MD medicines. I don't know who told you all these things that the orthopedic doctor is against you. That all the physicians are supporting me. I wanted to give this book, but then today I decided let these books be what? Silent. I met at last of 150 books, chapters, and it is better. Let it be with what? With me after my death. Because my heart is not working very well. It is not functioning well. So after some time I will die. And I'm not afraid of death. But then you will lose the knowledge. That is my biggest fear, that people will suffer. And why people will suffer? Because you people did not take initiative. It's okay. You don't earn money. People will just suffer. And then tomorrow you go to God and say, I did not do things. Same is with my physiotherapist. I work with 100 patients. They support with me only 10 patients, 20 patients. Non-stop I work. I took my discharge from the hospital after 6 hours of heart attack. They've given me cardiac shock. And then when I saw I was okay, I discharged and I immediately joined my duty. See my sincerity? Immediately I joined my duty. I did not take one day rest also. And I'm bringing what? CT scan, MRI. You see, we have changed to a new building within 2 days. Can you hear me, Anand?
Yes, I am listening.
You see, now we are bringing what? 144 slice CT scan, so that I can teach you very deep brain mapping and all. But then after all, I decided it is better to practice than to teach you. Because when I tell you that you learn now the basic thing, you learn all the important things, what is necessary, that how to do the dissection of the brain in the 3D, and then how to reach the particular what area, how to recover with one needle. You cannot reach. You have to create a pathway. There are pathways. Whenever there is a damage inside the brain, there are pathways, brother. We have to recover these pathways. You are a professor. You can motivate people. You can change things. You can bring a new world in this knowledge. You can do a lot of things for the society. Only your silence is the biggest problem. People are silent. So better let me be also silent. Let me teach as much as I can, so that when I die, I don't die with what? In my mind that I did not teach. But while giving books, it is better not to give the books, because I feel the world is selfish. What is my harm? No harm. I'm still having patience. I'm living a comfortable life. After some time, I die. Very happy. 5th heart attack has happened. 6th will happen and I will die. My health is deteriorated to that level where I'm taking ketamine to 3 level, 3 milligram ketamine, 4 milligram ketamine. And still I'm working. Why? Why am I putting these videos? So that you people can be motivated, how Parkinson's life can be improved, how this man at the age of 76 years can live a very good life. And is a post-stroke Parkinson. I'll post his page also today. The post-stroke Parkinson. You see, in 22 days, how I recovered with my new method. I bought the entire eye unit, but people are not interested what to do. I'm sorry to say, no one, only very few people are interested to learn. Learning is okay, but working for the society and working for your people, helping people to recover, teaching the society, imparting new knowledge, you, Bharat, all you become together, what will be the importance? You will learn from Bharat, Bharat will learn from you. So much things can happen. So much goodness will come to homeopathy. All homeopathy doctors are practicing allopathy. You know that? They have lost confidence on homeopathy. Why? Because they do not know how to use homeopathy. And my father was a cardiac anesthesiologist. He uses only homeopathy and he has recovered coma patient in just 5 drops. He gave 5 drops in the eyes and the eyes opened. He's a very good homeopathy doctor now. No doubt he made some mistakes, but now he's a very good homeopathy doctor. I'm very proud of Dr. Mohan Singh that he has become a very good homeopathy doctor. Instead of prescribing allopathic medicines, he prescribes only homeopathy medicines. Being a cardio-anesthesiologist, professor of anesthesiology, he is doing that. You imagine. So you all can do it. In Bangladesh, is saying, "Jodi tor kyo dakshene kyo ashena, tobe ekla cholore." If no one is coming by your voice, no one is hearing you, you work alone. I am working alone, you see. Still, I have not given up. After this, again, I will go down and again, I will recover patients up to night 1 o'clock. Till I can, till my body supports, I keep working. It is very sad that we are not bothered about human beings. Only your words are enough. Only your motivation is enough. Only your team is enough. 1 people, 3 team. So much good work can happen in Gujarat. I told I will come every day. Whatever you give, I will take. Now I am no more under my brother. You don't pay me money also, then also okay. Because earlier I was in the pressure of my brother. My brother used to put lot of pressure for money. Now I'm independent. I'm an orphan. So I'm no more in pressure that you give me 5 lakh rupees, 6 lakh rupees. No, I'm no more in pressure. I'm no one in pressure that I must teach you all the advanced stages of pain, all the things. Because this time I was really offended that a homeopathy doctor is practicing allopathic medicines and they have no faith in homeopathy subject. Because we are practicing homeopathy, we are doing good homeopathy practice. We have more faith in homeopathy. You all can do very good. I tell you, you all are the best physicians. You can change medical science. You can change a lot of things. But you have to take initiative, my brother. I'm very sorry to say that. I'm sorry if my words have hurted you, but this time I was really hurted by the way this younger generation is doing. Tomorrow homeopathy will be finished if these things goes on.
Excuse me, sir.
Yes.
Sir, Mohan Singh sir is practicing electrohomeopathy, sir, not.
No. Mohan Singh sir is not practicing electrohomeopathy. He is practicing a very good herbal. He is using a cocktail of many things.
Yes, sir. Yeah, because he is in our group, sir. We are studying him under one.
See, he is in all the groups. The most beautiful part of Mohan Singh is a legendary professor. He is retired from the best medical college. He has been HOD. He has been teaching more than 150 anesthetists. How much? More than 150 anesthetists in his life. He has given MD.
Yes, sir. So no matter anything we practice, we should give satisfaction to the patient.
No, no. You can, the best thing of Mohan Singh is that even at the age of 75, he is a student. He is my student also. You know that?
Yes, sir.
He met me as a student. Now he's my father.
Yes.
I only encouraged him to practice all these things. Instead of giving allopathic medicine, because my mother died with what? Antibiotics, too much high antibiotics. My father died with pantoprazole. My patients do not die. My patients are recovering. See? Why? Because we are not practicing high allopathic drugs. We are practicing minimum allopathic drugs. Even my MD medicine is not practicing. He also tells me to teach all this knowledge.
Right, sir.
So this is my humble request to all of you that please become united, please become one group, please become support each other. Society needs you. They are suffering very badly. Every day we have road traffic accident. Every year we lose young children. Every year we lose young people. Every year, month, every day, every minute, one stroke patient. Every minute things are going wrong. Why don't you correct these things? Why become one?
So it's all because of egoism, because all the pathy, they just have their own
No
egoism.
petty is egoism. Problem is your laziness. I don't want to do that. Mohan Singh is not lazy. I am not lazy. My team is not lazy. They are also working up to night 2 o'clock.
Yes, sir, we can see the results, sir.
I'll show you how I recover a very advanced stage of DM, motor neuron disease, which come from Kerala to me. You see, people from Kerala, they come to me. People from all over the world, they come to me. Why? After treating in NUS University of Singapore, they come to me. Why?
Yes, sir, they're getting good results. That's why they come.
No, because we are dedicated. We just want that you all people learn all these things what we have done.
Yes, sir.
But then I don't know why things are not coming up. No doctor is egoistic. Egoist means I go. I means God which is inside you has gone.
Yes, right, sir.
When the God inside you is gone, you are nothing. You are just what? Human body, good for nothing. I go.
Yes, sir. The person who understands it's better.
Huh?
The person who understands it, it is okay then.
See, am I going to lose anything if I don't give this book to anyone?
No, sir.
If I don't teach the higher methods, am I going to lose anything?
Nothing. But your nature is not that, no, sir.
No, my nature is that. No.
No, sir.
Yes.
We need another Shastri, sir. We don't want
You
to
go
forget
and
you.
find Sastri.
No, we don't want to forget you, sir.
No, you forget what I will do my duty as long as I am alive. I'll continue to do my seminars. I'll continue to do my workshop, and everything will be continued till I am alive. And after that, but the important books which I have written, how to make paralysis easy, all these books you will never get. I'll give it only to the sincere students, dedicated students, those who have really helped me. I told you, I've done huge research.
Yes, sir.
Right?
Yes, sir. Right.
Because I work still 19 to 20 hours a day.
Yes, sir. We have seen it, sir.
Yes, sir.
Yes. No one can know very difficult areas of brain pathways other than me through scalp. By putting few needles in the scalp, you can recover the what? By taking within 4,000 rupees, you can develop stem cells and use small amount of glutathione, patient recovers very fast. In second dose, third dose, patient recovers. So Anand, this is my advice. You are a professor. You can do a lot of things for the people. Only what you need is to speak. Just speak few words. Motivate people. You are a professor. You have motivated so many people. Only what you need is to motivate and create a team. Without a team, no one can work. You see, I work with a team of how many doctors you see? I was one, now you see so many doctors. And all these doctors, they close the clinic at 10 o'clock and they come here up to 1 o'clock. And so much knowledge we interchange. Within 1 minute, I can recover your knee pain now. So this is my humble request. Till I am alive, learn from me. After my death, you will not get MK Sastri for many, many years. Because for 200 years, no one spoke about paralysis. I don't know after 100 years what you are going to get, at least not in your lifetime. So this is my humble request. I'm not scolding you, only very humbly requesting you, please do something for the society. You have capability, you can speak, you can only to convince one person, Joshi. Joshi is your friend. Chintan. Bharat is already convinced. And if you are not doing, I'm going to do with Bharat. But then I will never allow you all to come to me anymore in my life. If then I have to do with online with Bharat, I and Bharat will do. I have already told Bharat, take a small clinic. I will do and I'll bring patients. I have confidence enough to bring patients in Gujarat also. And I will show you how I recover patients. None of my treated patients in Gujarat have recovered. Why? Because people did not learn. Because people did not purchase pain. Because people did not do anything. No motivation, nothing. And here you see, we have opened 44-bedded hospital in 2 months. We are bringing CT, MRI, everything with 2,000 rupees, you see. So it is up to you, my brother, what you want. You want to recover paralysis with one needle? Learn with 144 slice CT scan tomorrow? Or you just want to do what? Unscientific method of learning. It's all up to you. I'm not scolding anyone. I'm only requesting because people are suffering. If we don't become one today, if we don't support each other today, no one will help us tomorrow. You see, I've recovered central pontine myelinosis in 16 days. Where the neurologist said she will never recover, I recovered her in 16 days. She is walking. She is E4 M3, E4 V3 M6. Only voice she cannot speak very well. After some time she will speak also. You see, I can teach you stem cells in how many rupees? 4,000 rupees. 3,000 rupees. And that was a higher grade stem cells. One doctor came from Mumbai. We discussed, we studied research papers, and we did it. We take out it from the iliac crust, and then we mix, and when glutathione and all, and we give. Sometimes we give directly, intravenous, and also on the local sites, on the local nerve roots, brachial plexus, clavicle plexus, clavicle bone, and all. We get very nice results, immediate results. Failure is never final. Success is never ending. What will I get from Gujarat? What will I get from Indonesia? What will I get from Nigeria? If you recover one eyesight, one was lost his eyesight. If you bring back his eyesight, what are you going to lose? You will earn money also. You can learn. Your name will go around the world. So what do you want? It's up to you. That's all. Thank you so much.
Thank you. Thank you, sir. Good night.
Everyone.
Thank
Bye.
Thank you, sir. Terima kasih.
Good night.
Good night, everybody. Have a lovely night. Shut the door.